name's Adam and this is Claudia. Today we're going to be talking about how you can use Dr. K Kinesiology Tape to help with knee pain. So this particular application could be used for a variety of different types of knee injuries, perhaps pain around your kneecap or even your patella tendon, or even pain associated with maybe the joint line of your knee after surgery or perhaps with a meniscus injury or something like that. So first we're going to measure the tape. So I'll get Claudia to spin around with her legs up on the bed for me. And the first piece we're going to measure is the piece that runs horizontally across the front of your knee. So we're going to be mindful of the fact that the tape will stretch once we've actually applied it. So we don't want to cut too big a piece. And then we're going to measure a piece that runs from around the outside of the knee, aiming for the bump below the knee, and then another one that follows that same pathway on the inside. So again, mindful of the fact that the tape's going to be longer, so we probably only need to measure a piece that comes from our intended starting point above there to about where the base of that knee, the point we're looking for to finish it, is. So around about yay long. And we're going to cut the piece, and then another piece the same size. And we're going to prepare our tape by cutting the corners off too.
Right, sir.
So the first piece we're going to apply is our horizontal piece across the front of the knee. So this one's going to be a folded piece where we tear through the middle to expose the tape. We're going to peel back the sides, and then that middle piece is going to be our unloaded piece for the front of the knee. So I'll get Claudia to help from here. So you can grab on to the tape, and we want to put it on about 75% tension. We're aiming to cover the bottom of your kneecap with it. So pull nice and firm, stick down most of the way out, and then you can leave the tabs on either end, one at a time, and then that goes on without any tension either side. And then we can use our second piece, preparing by folding down, tearing along a little folded line, and then peeling down that way. Becomes our attachment point. So we'll start with the outside. So Claudia, you can take over from here. So we're going to start aiming to try and line up our tape to finish at the bump down the bottom there. So our starting point sits up high. We can peel off the bulk of the length of the tape except for the last couple of inches, holding onto that last little point down there. And we're going to try and aim to stretch that whole area about 50%. And once we hit the bump below our knee, we're going to let the tension go, and the remaining tape's going to slide on without any tension. And our final piece, we're going to do the same thing in reverse. So tearing and folding as we've shown before, starting on the opposite side to where we started previously. Making sure you give it a good rub to make it stick to begin with. Peel back most of the way, following the contour of the inside of your knee, running the tape right next to the edge of your kneecap. So we're going to come a little bit closer than that. So we're going to come past the edge of the kneecap, that's it. Aiming for the bump below our knee. Once we hit that bump, we can let the tape relax off, and the last little section is going to go in without any tension. And so make sure we give the whole thing a good rub to get the heat activated adhesive to stick properly. So the key thing for any kinesio taping application is making sure the tape stays on effectively. So in this particular case, it's prone to catching on clothing or other things while you're getting dressed. Particularly where the tape crosses itself, it sticks better to you than it does to the tape. And so you need to ensure that doesn't catch on things. Same with dressing, showering, and in bed. So sometimes covering it in bed is helpful, making sure that you pat dry after a shower rather than rubbing with a towel. Preparing the skin effectively is almost important too, so minimising excessive hair, moisturisers, creams, that sort of thing. And in terms of management of these sorts of injuries, in addition to the taping, we can also use treatment techniques like rice, massage, exercises to support strength and rehabilitation to build strength around the knee. So for more information, visit sportstrap.com.au.